My count, guys, this is the first part of the procedure. We've got three sheaths in the right groin, one in the left. We've got two catheters in Rob's neck. You can see here, left and right, in the neck. Can you see his molars on the top and bottom? And particularly what we're going to do is stimulate from the left neck. And in the left neck, we are going to stimulate. And here we watch Rob's heart rate and blood pressure. And let's see what happens. HFS on, Elaine?
Yes, sir.
So we're going to stimulate the neck, which is coming, and look at his blood pressure response. So he has initiated a pause of around 3 seconds, just with activation of the vagus from the left side of the neck. And this is stage 1 of the procedure, where we're trying to determine the outcome from an upstream effect. Ideally, when we ablate in the heart, we do the stimulation in the neck again, we will no longer have the ability to induce this vagal response. Step 2. So stage 3 now, what we've done is we've shown you that the heart block stops the heart on this screen, stimulating from the left neck. We've done ablation on the heart in this crux region, which are important, contains important vagal fibers to the AV node. Elaine, get ready to pace.
Yes, sir.
And we HFS on. We're going to stim from the neck again. So stimulation from the neck, if you see this, the stimulation artifact will come on. Our HFS on. And what you'll find now is that you no longer have that block response. Earlier on, you could see the blood pressure actually come apart when the patient has slowing. And now it doesn't do that anymore. So consistently, we've been able to abolish the vagal response from the left neck. So that's stage 3. Okay, so stage 4 is now where we look to denervate the sinus node. So if you look at the heart rate at 65 beats per minute, that is a heart rate that is driven by Rob's own pacemaker. And we know that that can also slow during Rob's episodes. So what we're going to do is we're going to ablate now at an area that may, I suspect, lead to a heart rate increase for Rob. Because if we get this right, we will be able to slow his heart rate, increase his heart rate from 66, 70, 72, 30 watts, right? 76.
Yeah.
And you can see live, we are manifesting an increase in his heart rate with a single ablation here from a baseline of 70 to 88, 90. And this is a good sign because we are getting rid of the vagus as it supplies his natural pacemaker. And one good outcome here is to see that his heart rate has shot up 20 points with a single ablation point here, where we think the vagus innervates into the sinoatrial node, which is responsible for Rob's beat-to-beat pacemaker activity. You remember this is stage 4, and in stage 3, what we did is we denervated the vagus in this area that supplies Rob's AV node, which is conducting from the atrial signal to the ventricle. So we no longer have the conduction or the ability to slow his AV node electrically. So this is stage 4. I'm just going to consolidate, and we're close to the end of this procedure now. Thank you. So stage 5 is when we test and stimulate from the neck. And remember earlier on, when we stimulated from the neck, the heart stopped. Elaine, HFS on from the left neck. And what we're going to look at is whether or not the heart is still stopping. So earlier on, when we did this, the heart slowed and stopped. And Rob's heart no longer has the capacity to slow the sinus node down. So we've done 2 things. We have disconnected Rob's ability to conduct from atria to ventricle, or to block from atria to ventricle. And secondly, we have now stopped Rob from having sinus arrest, or a slowing of his natural pacemaker. And so this procedure has reached its endpoint. So that's stage 5 complete. Thank you. So stage 6, we have just finished a case. You can see that we're pressing on Rob's groin. We're pulling his catheters out. But what I want to say is at the end of the procedure, to test that we have sufficiently vaguely denervated Rob's heart, we give atropine. Now, atropine is a drug that blocks the vagus fully. And typically when you give atropine, you expect a heart rate to increase quite a lot. Rob's heart rate was 82 beats per minute at the end of the procedure. And when we gave atropine at the end to block his vagal response, we would have expected Rob's heart to go up or higher in his heart rate. but it hasn't. So his heart rate is stuck at 85, which is just 3 points higher than 82. And that's good because the vagal denervation that we've done in Rob's heart is likely to be sufficient, because when you give a drug to block the vagus, it doesn't do any more heart rate increase. So this is a really excellent outcome. Just to recap, stage 1 is getting the sheaths in and getting the neck stimulation. Stage 2 is when we were able, before ablation, to prove that in the neck we could slow Rob's heart rate down, leading to a pause, but also lead to AV block, leading to a pause in his blood pressure, which explains the symptoms. Stage 3 is getting rid of the atrioventricular pauses by ablating somewhere in the crux of his left atrium, and that's what we showed earlier on in the video. And following stage 3, we were no longer able to get the AV block pause. Stage 4 is when we denervated Rob's natural pacemaker, so Rob's resting heart rate shot up from 70 to 82, and stage 5 is the Atropine test, which ends the study. So all in all, it's been a really good physiological outcome for Rob. He's waking up now, we're pulling the sheaths, and I'll see him in clinic in due course. Okay, Rob, it's now 3 hours since your ablation. I have fed back to you that actually the ablation was a success. We were able to induce AV block, and following the induction of AV block, we were able to then ablate in your heart. And when we stimulate from your neck again to try and show the AV block, we weren't able to show it again. So from my point of view, the end point was achieved. I know it's some time since you came out. You're still a bit groggy, but can you tell me how the procedure went as far as you're concerned?
In terms of going in, really straightforward. I couldn't have been any more straightforward and relaxed in there. The team were great as well. Just coming out, just woke up, just more tired than anything else. Yeah, groggy, don't feel any discomfort anywhere. The only thing I can see just coming out the other side is just tiredness.
Okay.
Yeah, I'm sure. Okay. Yeah.
Okay. Well, I think part of that is the general anesthesia. You've been under for about 2 hours, 45 minutes, just shy of 3 hours, and I think it's very usual to feel a bit sleepy afterwards. And so what I'll suggest is you can go home later on, sleep it off. The groins look okay. You don't have chest pain, do you?
No, nothing
Good.
at all.
And your heart rate is much better now, because when you came in, your heart rate was at 60 beats a minute. It's now a respectable 92, higher than what you came in with, which is part of the reason we've done this procedure, to try and denervate the heart and not allow the vagal influence to be so strong on your natural pacemaker, the sinoatrial node, and the AV node, the conduction between the atria and ventricular. Good, Rob. All the best.